So the shoulder is a fairly complicated joint when it comes to assessment and management. So I'm only going to touch on a couple of conditions today due to time constraints. It's important to note that shoulder complaints are one of the most common complaints of the upper extremity in a standard musculoskeletal private practice. It's making up to 9.8% of all patients. And due to their complexities and the individual costs that people can face with care and sick leave, a high occurrence in the workplace means that they have placed quite a significant burden on the individual and on society. Prior to moving on to each individual condition, I thought the best way for us to delve into the shoulder joint was to go over in more detail the functional anatomy and the forces that act around this shoulder to stabilise to allow for full mobility whilst maintaining stability, and subsequently how many abnormalities may come about. So when we refer to the shoulder joint, there are static as well as dynamic structures acting to stabilise. So the static structures consist of the glenohumeral labrum and the capsule, and the glenohumeral ligaments are really deep in the joint. And your dynamic stabilisers are the rotator cuff muscles, being the supraspinatus, infraspinatus, teres minor, and subscapularis, and the scapular stabilisers, your serratus anterior, trapezius, pec minor, and levator scapulae. The rotator cuff not only acts to create movement, but it also synergistically contracts to and acts to centralise the humeral head in the glenoid socket throughout the shoulder's range of movement. Therefore, any imbalance in the rotator cuff by weakness or injury, this can result in migration of the humeral head, can lead to more stress and disrepair to structures, leading in that negative cycle. Another important factor is allowing for full shoulder movement is what we refer to as scapulohumeral rhythm. So the scapulothoracic, AC, SC, and glenohumeral joints must all move together to allow for full range. So when you raise your arm into the side, not only is your shoulder joint rotating upwards, but your scapula must start to move and rotate to allow for full movement. As the rotator cuff muscles arise from the scapula, a stable, well-positioned scapula is also important to provide an adequate base for these muscles to function effectively from.